Welcome, students of NKT. This is another episode of Test, Don't Guess. I'm excited to have on today Kjetil Larsen, all the way from Oslo, Norway. He is a corrective exercise specialist and a level 3 NKT practitioner. KJ, thanks for being on today.
Thanks for having me.
KJ, tell me how you got started, not only in the field of NKT, but just fitness and exercise. What brought you into all of this?
Well, it was pretty much just basic exercise interest like everyone else. But what I was noticing as I was training is that I got injured all the time, right? Knee pain and elbow pain and shoulder pain and whatever. And I struggled to find help for these things because even the most mundane injury, at least in my view now, was kind of difficult to get help from. And I'm sure a lot of people can relate to that. So pretty much my background is in electromechanics. So I would say I have a pretty good insight in general mechanics, right? So when I started to try to go into the things myself and try to find maybe there has to be an answer to my issues, looking into the anatomy and so on, and I just took it from there and got gradually more and more interested in anatomy, in biomechanics and so on. And eventually I quit my day job and I started my own business, and here I am, right? Yeah.
Wait, so you did electromechanics. So that's like what you went to college and you were doing. How long did you do that?
Well, it was 3 years.
Oh, okay.
Yeah.
That was as long as it lasted, and then you wanted to get into exercise.
Oh no, the education was 3 years. I worked with that for like So I don't know how long I worked with that. At least 5 years.
How did you transition straight to private practice? You didn't work for anybody else?
Yeah, actually it was really rough because I started immediately at like a private, when you rent an office, I don't know how to say that in English, but when you rent an office in a building and you, like a clinic, for example, you rent an office in a clinic and you have the brand of the clinic, but you work privately. You understand what I mean?
Yeah, I know what you mean. Yeah.
So, generally I started out as a trainer, right? But I always had I always wanted to work with rehab, of course. So it was really difficult for me to get a trainer job because when I started talking about what I really wanted to work with, the employers were like, oh, they did not want to hire me, right? So I really started, I can understand them, I can understand that. I didn't in the moment, but eventually I could understand why they did not want to hire me. It smelled like trouble, right?
Yeah.
But eventually I got like a semi-employment in private practice at a clinic. And of course, that was really rough because one thing is getting a name for yourself in a gym and getting clients in a gym. Another thing is if you work at a clinic, you have to get a name for yourself in the city, right? And get clients from the city rather than having potential clients all the way around you all the time. So, I was starting in private practice then. That was in 2000 and that was about 3.5 years ago. Yeah.
Okay.
Yeah. And they gradually built this from there. So now in the beginning, I was doing more like, training, corrective exercise training, stuff like that. And it just gradually turned more and more into pure therapy, if you will. And today, I guess I'm barely in the gym. Sometimes I go to the gym, but generally I'm most of the time in my office.
Yeah.
It's more therapy specific, I guess you could say.
You mean to say that you don't train clients in the gym? Because it looks like you obviously go to the gym.
Well, it depends. Not so much anymore. It's more if the clients say that I mean, yes, I train, but if my clients say that I get pain when I'm doing vertical press or whatever, obviously I will have to address that and review their technique and so on. But I don't do so much training anymore, like doing a real program with someone, more to evaluate their movement and to find issues and correct those issues, right? And when I see that they can execute these movements without getting themselves into trouble, then I don't pursue that training anymore.
Yeah. Do you feel like your former field of work that you went and studied at college, do you feel like that has applied and helped you learn in the fitness field at all, or was it kind of not relevant?
Oh yeah. I think I would have no chance of making the connections that I have without that background.
Right.
Because when you are used to working with automated systems, you have a view. I would say that it's pretty similar to biomechanics and neurological things, actually, because most of the time when I'm working with someone, if I use mechanical principles of that, for example, friction and so on, I would say that most of the time it can be quite, it can correlate very well. Most of the things I write about and so on, because they are quite eccentric, right? Most of the time the things are based on my background in electromechanics.
Oh, that's fascinating.
Absolutely.
That's really cool. And then,
to be honest with you, I think that background has helped me and will continue to help me more than probably anything else.
Oh, wow.
I really think so. Yeah, I could be wrong, but that's what I feel anyway.
So, okay, so private practice for about 3 years now, you said, and then when did you start?
3.5 years.
Okay, 3.5 years, and then when did you start getting into NKT? Tell me about that.
Well, I started following David. I saw a post by Perry Nicholson, I guess, about the obturators or some stuff like that, and I was really interested in that time. And that was probably in 2014. Okay. So then I bought David's book, and of course, I just read my way to everything. So I expected to just buy his book and get everything from the book and not having to take his course. But that didn't really happen. So I read his book, I learned all the tests, and I started to implement it in the late 2014. But of course, when you haven't taken the course, you feel very insecure. How do I interpret TL, right? How hard should I test? How do I even start looking for a TL? So I could spend like 30 minutes just releasing random things and just see if it helped. And I did that for about 6 months, and I could get some results. But eventually, I decided that I want to take David's class. So I took level 1 in 2015 in London with David, and that really revolutionized my practice, I have to say. Even the stuff I just learned from the book, that you actually test the muscles rather than just palpate it and release it based on what you're feeling. Even just reading the book and learning the tests really made a big difference for me. But when I could learn the real protocol, I really get more confident with how I utilize the protocol. That made a huge difference in my efficiency, in my results, in my confidence. And I really felt that it could be implemented so perfectly into what I was already doing. And that is very important for me, because I have, like I told you, this background, right? That is my foundation. And I need all this continuing ed I take to fit into my protocol, because or at least into my way of thinking, because if it doesn't, then I cannot use it. Unless it obviously makes my protocol obsolete. But for at least until now, that has not happened, right? And I felt NKT really complemented what I was already doing, and that's why I love NKT so much, because it makes what you're already doing better.
Yeah.
In my case, much better.
Absolutely, it does do that. Yeah. So then you took level 1, and that was really great. And then how did you get into level 2 and level 3? How did you progress further?
Well, it's funny because when I took level 1, I had already been practicing like pseudo NKT for like 6 months. So when I took level 1, I felt like the king of the king of NKT, and doing this level 1 tests, right? And this is so felt like the shit, and then I took I felt really ready to take the next level. And I was like, I'm going to nail this shit. To be honest with you. And then I took level 2 with Kathy, and I won't say that I got my ass handed to me, but I was slightly overwhelmed, because there's a big difference. David is kind of secretive, right, about the protocol. So I did not really have a way to rehearse or practice the information until I got it, like I did with level 1, because I read the book, right, and I practiced the book. So when I got there and I had tried to read, I read Anatomy Trains and all that, but I really was not ready to put it into that system that level 2 gives you. So I felt like a newbie again when I came to level 2. It was all really, really interesting for me. I think the time went really fast and learning a lot of things. And, obviously I had to practice it a lot. And I feel that implementing the systematic approach that you learn in level 2, it really, 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 I think it merged perfectly with the knowledge that level 1 gives you.
Yeah.
And of course, then the new practicing was to use the system much more systematic, right? Rather than finding 100 TLs and disconnection to disconnection and all that. Because as you grow in NKT, you know that all that is basically nonsense, right? You are finding some key triggers as you progress and you get more knowledgeable about the protocol. So from feeling like the shit and finding all of these patterns, right, and finding a TL like like the boss, you feel like, wow, I really don't know nothing. How, like when Kathy demonstrated it, she could find a TL that just fixed everything.
Yeah.
And for me, it was a huge challenge to do that. And even when I thought I found a connection that was important, for example, in a lateral subsystem or something, I would expect the whole system to come online, but most of the time it didn't.
Yeah.
Yeah. So, and that is how I quickly realized that, wow, there's a lot more to learn. But, I love that. I love a challenge. And of course that after I took level 2, you get the systems, but you don't really learn to put it into a hierarchy. So you still have many things to test, but not really the hierarchy. I mean, yes, you have the deep core system, right? But you don't really know how to treat it until you take level 3. Right? So that brings us to level 3, I guess. And when I took level 3 with David in 2016, everything just came together for me. When you learn how to put everything in a hierarchy and how to track the line there, all that insecurity that I had after taking level 2, it just, I would say it relatively quickly vanished because everything just started to make sense. It was not so mystical anymore.
Yeah, that is very true about level 3. And I know it's when you do NKT, then suddenly there's like so many relationships that you wouldn't really even realize were a thing. And it's like, oh, whoa, that I never even thought about connecting those two muscles together, or that movement pattern with this dysfunction. I know you have to rethink so many things. So when you brought it back into your office, what was it like treating people kind of the first few months after taking level 1? And now that you knew the protocol and you knew how it worked, what was it like bringing it back to your clients?
Well, I would just say it was not like a major difference because I had been practicing so much. I was following, like I said, David is very secretive, but I was following all of these NKT bloggers and like asking them sneaky questions to get the secrets. Yeah, it's true. And I was writing these charts with like iliacus sartorius and all of this stuff that I didn't really understand, right? Because I really didn't want to pay for that course. I wanted to learn everything on my own.
Yeah.
But I would say that I did a pretty good job. So although the system was much more refined for me after I took level 1, there was, of course, I could find the TLs and things much easier, and I had more things to test more specifically. But I would say that I became more efficient in doing what I was already doing because I kind of already implemented the level 1 protocol, right? Because the level 1 protocol is outlined in David's book, right? Yeah. So it was, I would say that after level 2, things really started to change for me.
And when you learned the global patterns and kind of the big picture of NKT, that was when it started to change things. Are there any like specific problems you worked on with clients that maybe you didn't really know how to treat, or you just didn't know how to treat very effectively, that once you learned NKT and kind of went up in the levels of NKT, you realized how to treat it much better?
Oh yeah. Everything. Almost everything. Yeah. When, like David says, test don't guess, right? And it almost is becoming like a little cliche because we hear it so often, but it is so true. It is so true because I cannot speak for everyone, but what I was doing before, I was palpating it. I was checking strength with some exercises, but not for everything. There were some certain things, especially maybe problems I had myself. But if someone came with forward posture, headaches or whatever, I would start to massage those muscles. I would just, oh, that's tense, I will release it, I will needle it and so on. And, when you start testing muscles and you get an indication of its true status, then everything changes, because at least for me, I realized that I had been doing so many mistakes, so many false presumptions, right? So let's say trochanteric bursitis is a great example. So we know that the TFL and the IT band lies on top of the greater trochanter, right?
Mm-hmm.
And there you have the superficial trochanteric bursa. And a lot of people have pain in this area, and especially women, and it can also cause runner's knee and so on. And I was releasing that band like
Mm-hmm.
a lot, right? Yeah.
Right.
Yeah. And I remember asking David in level 1, well, what do you usually find with trochanteric bursitis? And he said, well, it's a weak TFL. And, that simple thing, it really changed a lot for me, because I learned that, okay, if something hurts, it's usually weak.
Mm.
So I started seeing that using the NKT protocol, I can generally, if something was hurting and I tested it without allowing the client to cheat, obviously, usually that would reveal weakness. And when I treated it by strengthening it and finding out the TL for that respective muscle, not only did they get pain-free, but it happened fast. Because when you allow their nervous system to connect to that muscle, they get better much faster than with just general strengthening. And especially because NKT allows you to find the patterns, right? So when you address the patterns and the hierarchy, rather than just a local issue, of course, you get much better results.
Mm-hmm. Yeah, very true. Now, what you do with your NKT today, when you bring people in the office, how do you start to explain NKT to them? How do you start to implement, okay, somebody comes in, they've never had NKT before. What's that kind of first client experience with you doing NKT on them?
Well, I don't really explain what I'm doing, I'm trying to talk more about the issue and my findings rather than testing and TLs, because the TL is very diffuse, right?
Mm-hmm.
Because you're asking the body, right? You're asking the body, is this what you want? And, I don't want to get into that conversation. Generally, I don't want to get into that conversation because it's a difficult thing to explain, and especially if you have a relatively evidence-based practice.
Mm-hmm.
At least evidence-informed, as I like to use practice.
Mm-hmm.
I prefer to speak about more concrete things. So for example, if they have pain there and there, I will test that muscle. You see that's weak? Yeah, I can feel it. You feel it's painful when I touch it? Yeah, I can feel it, right? And I show them in my anatomy books, this is the muscle, blah, blah, blah. And then when I start to test them, I just do the TL. I find the TL and I retest the stronger. Okay, so you're compensating here. That's what I'm telling them. Mm-hmm. And they will say, okay. Mm-hmm. So then I will say, pretty rarely will they ask, how do you know that? Mm-hmm. And if they ask that, I will do the TL again. I will test them without the TL. Look, you're weak. I'll take the TL. Look, you're strong. That is how I know that. And generally they will say, okay, I understand now. They don't understand, of course, but they just pretend like it, right?
Yeah.
And rarely they start to understand. They start to ask, well, how do you interpret that? And I will basically just tell them, on the neurological level, on the mechanism within the body, I don't know. I just know it works. It's a system called neurokinetic therapy. It's really good. I have great results with it. So you just have to trust me. And they will say, okay. And if they don't, I'm not going to treat them.
Yeah. Well, it sounds like you got some pretty nice and easy clients that they're mostly just willing to go with it and let you do that. That's nice.
But I think, I don't make a big deal out of it.
Yeah.
If you can initiate the session with a lot of facts and a lot of concrete stuff, mm-hmm. rather than maybe a little more esoteric stuff, I think they will be much more able to just take what you say, Mm-hmm. And I also, I also do a lot of writing, so generally they have some respect for my work before they come in. It's not like generally it's not just a random referred client, right? Because then you have a little more to prove, if you will. You understand what I mean?
Right.
Yeah. I think that helps a lot. But generally, I try to stay away from the TL conversation.
Mm-hmm.
Yeah.
Yeah. I know. I get a lot of black magic references in my office. Oh no, that
Oh,
was
really?
what kind of voodoo was that? And I just,
Yeah.
oh, it was voodoo. Don't worry about it.
Yeah.
Yeah,
So,
I know.
I got that after I took level 1. I got that a lot,
Yeah.
and I know why I got it. I have
Mm.
no single doubt why I got it, because I was making a big deal out of it.
Mm.
Okay, so I was making an expectation for the client, like, look now, look what's going to happen now. We're going to make this muscle strong and so on,
Mm.
right? And then they are starting to ponder, why is this happening? And I don't do that anymore, because I simply don't want to have that conversation.
Mm-hmm.
Okay, but I'm not saying that it's bad to have that conversation. I'm just saying that from my practice, I prefer not to have the TL conversation.
Yeah, I mean, it can kind of take a lot of time, and sometimes it confuses people more. And so, yeah, no, I
Yeah,
totally get you on that. Yeah,
yeah, yeah.
yeah. And then, so you said that you did some other, concrete explanations with clients before that kind of gave you some rapport. And so, what are some other things when a client first comes in, conversations you might have with them, or initial assessments you might do with them?
Yeah, well, I'll obviously have them tell me their history, right?
Mm-hmm.
And based on what they're telling me, I will start to have some theories of what this is. And that is another thing. I'm trying not to go off here, but that is another thing. As the more specific you get in the etiologies of pain and of pain mechanisms, the more easy it is to talk about that rather than just talk about the testing. And I also think that has gotten like the conversation to a little different topic, if you understand what I mean.
Mm.
Yeah, but I will ask them their issue, where's the pain, what causes the pain, what kind of pain is it, blah blah blah, the deal. And as they answer, I will say, okay, well, I think it could be this and this and this. I have to examine you. It depends on how much this is, obviously. So after we stop talking, I always have them stand up first. I look at their posture. I evaluate the ankle position. I evaluate the rotation of the talus. I will evaluate if there is torsion within the knee, if there's gliding within the knee.
Mm-hmm.
For example, I will measure the tibial tuberosity versus the patella. So I will see if the tibial tuberosity is lateral, for example, from the mid patella. That is something I almost always do. I will look at their pelvic alignment, obviously, which is you'll probably seen it, that I talk a lot about that.
Mm-hmm.
Look for, is there normal activation, just standing activation of their lumbosacral erectors? Is there a flattened lordosis? Are they hinged? Are they hanging on the hip? Are they tucking the pelvis? Are they hanging on the neck? Or is the scapula depressed? All that stuff, I will look at it. And as I see it, I will generally point it out just quickly. That gives them something to think about, right? And as I put them on the table, generally I start supine. I will reassess the things I did standing. I will, for example, if it's a knee issue, I will see, okay, did the alignment of the knee, did it differ when they lie down? I will squeeze the patella into the femoral groove. Does that cause pain? It depends a lot. I could go on and on about this, but I do a lot of testing, like more specific. I do a lot of testing before I do the NKT testing.
Right.
So I think that your NKT testing can be much more specific if you evaluate the structure first.
Absolutely.
Right?
Yeah.
Yeah.
And I mean,
Because
David
then you
does
know where
that.
to go.
Yeah. Yeah. You see that commonly in the courses. David's doing range of motion, or, Thomas is talking about palpation, or you got to do some tests in order to guide your tests,
Yeah, exactly.
Absolutely.
And then you combine all that information to lead you where to test, right? And for example, if you're so let's say the patient is having trap pain, right? This is very common, neck pain or pain upon the rotation or whatever. And you see that they're standing in a hinge neck position and their scapula is just hanging down. And then you know that when you're testing the trapezius, let's say you find a strong and a clear trapezius, well, probably you're not going to trust that, right? At least maybe in level 1, yes. But if we can get everything to make sense, then it is more likely that we can get a good result rather than just random testing.
Yeah.
So, you could find a trap relationship, trap strong and clear, but then you can also, if you can do the relational compensation or whatever, you can probably find something else that cancels out that trap, right? And this is what you want, if you understand what I mean. Yeah.
Yeah. Yeah.
Because this makes more sense. It does not make sense that a trap is overactive if they are hanging down here all day long. It does not make sense. So I generally try to make sense of my testing. I base my testing on what I have found based on palpation, based on general tone of the client. Some people are really stressed, and I will be much more careful with the testing and be a little more critical with the testing. And of course, based on structure, right? Their structural status.
Yeah. What is your session time? Do you have like different times for people on initial assessment and initial sessions versus others, and how much time do you spend with people?
I have, it depends what they pay for.
Okay, right.
But I have an option on my website that they can have an initial consultation of 1 hour, 2 hours, or in extreme circumstances, 3 hours, right?
Okay.
If they have tremendous problems, then they could consider 3 hours. If this more, I generally work with chronic pain, so most of my clients have a lot of issues.
Right.
But I would say generally my initial consults are 2 hours.
Okay.
But it's up to the client. They choose for them.
Okay, you leave it up to them, and gotcha. Oh, I said you leave it up to them, but usually it's about 2 hours. Okay.
Yeah, I leave it up to them because, when everything comes to an end, they have to make decisions themselves. And it also gives you, if the patient comes in if they are a wreck and they purchased one initial session, that could mean that they are being cheap. And it can also mean that they just want to check out your practice, right? To see if this is for them. So, I leave it up to them, and I will see what happens and take it from there. Yeah. But generally, my follow-up sessions are 1 hour.
Oh, okay. Gotcha. All right. Yeah. So you've got a pretty good amount of time to work with people and do all these things. I'm thinking about like PTs and chiropractors where a lot of their sessions can be a half an hour, 45 minutes, but that's nice. And that you have some good amount of time to work with people. And,
I need that. I really need that because when people come in, I work with some pretty significant chronic pain issues, and I simply cannot deal with that in such a short time because first of all I need to do the examination. I need to let's say it's a follow-up. So let's say they have pain in their neck, dizziness, TOS, hip pain, and many things, and then I need to do the examination. I need to evaluate their progress, and I need to see that they're doing their exercises correctly. And, it takes time, and it takes a lot of time. It really does. And I feel that many times even 1 hour is not enough, but because it's also an economic aspect for the patients that I want to get them to the goal, right? I want to get them to the finish line. So I'm trying to, even though some clients would probably need 2 hours every time they came, that would be too heavy on their wallet, right? And then it's better to just do the best with what you have rather than pushing people to do this and that.
I know it's easy for me to want to go over sometimes in sessions. That always tells me, I know that I'm doing the right thing because I love this so much that I can go past the clock, So,
yeah, exactly.
Now back to your clients here. What kind of clients do you work with? Are they athletes? Are they young? Are they old? Are they just, you're talking about chronic pain. What's kind of the general, do you have any, sort of normal people that you see all the time? Well, let me rephrase that. People that, are you working mostly with a certain type of the population is what I mean to say.
Well, I would say it's pretty mixed. But, before I had maybe more, I would base it more on the type of issues they have rather than their age or whatever. So I would say that most of my clients, they are chronic pain sufferers. There's a lot of chronic neuralgia, stuff like that, TOS, lumbar plexus issues. Whiplash, a lot of whiplash patients, stuff like that. And so it's more about the type of problems they have than what kind of people they are, if you know what I mean, because I'm attracting those people because I write about those things, right? So the more I write about chronic pain, the more chronic pain patients I get.
Yeah.
I would like to work a little bit more with uh, athletes and so on, but I think, you know, I love writing about chronic pain, so as, you know, I'm just following the stream. We will see what happens.
Yeah. Yeah.
Yeah.
I know that you're a big book reader. What are other good books that you've read, or other kind of resources that you've learned from that have built up your practice a little bit more?
Oh, where do I begin? The biggest influence on my work, it is my background in electromechanics,
Mm-hmm.
and it is Evan Ostar's work, like I told you last time,
Mm-hmm.
and it is NKT
Mm-hmm.
by far, you know.
Yeah.
And now, you know, now I'm reading a lot of stuff, right, and books and so on, but you know, there's a big difference between reading something and taking a course and really making an impact in your work.
Mm.
I think that most of the courses I've taken and so on, you know, I'm not that impressed with it.
Just a last word you can give the students. What's something that maybe you've already said, but it's worth repeating, or mottos or slogans, or just a last word to NKT students?
Testing light is such a huge thing. And, you know, because when you do the TL and you test hard, they will get stronger. If you find a pretty good TL and you test them hard, they will get stronger. And this can greatly mislead you. Because if you are testing hard, they will clench a region, a complex. So you are actually testing a movement pattern or a clenching pattern rather than the muscle you really want to see. And it took me a long time to really, I mean, I kind of knew it, but my ego wouldn't let me let it go.
Yeah.
But it took me a while until I realized that, you know, my testing is not repeatable. I cannot reproduce my testing, and, you know, then you're doing something wrong. And then I started realizing, right, that my testing was too hard, that actually when I was testing the TFL, I was testing abduction and flexion in general, because they were utilizing everything, even their abdominals, right? And learning to test slow and really learning to refine and feel that neural lock, I think that is perhaps one of the most valuable things you can do with your NKT skills. And, you know, oftentimes I see you can even see sometimes advanced practitioners testing too hard. And I was one of them. You know, and even especially with testing hard can still give you results, because you're testing hard, right? You feel they get stronger, they're getting better. Yeah. I must be doing a great job, right?
Right.
But for me, it was that my results were not reproducible, and that made me stop and think and starting to test lighter and really get to find that muscle and really help to find that muscle. That really helped me to solve some of those more difficult cases, especially when you're working with chronic pain. Let's say it's a chronic QL injury, for example, right? So if they have a long history of QL issues, you know, that QL is not going to be able to produce a lot of force. And if you try to force it, that will create like an expectation in the client's mind, and they will also do their homework like that, and they will go too hard on everything. And sometimes that can lead to results, other times it will be ups and downs, other times you will not have results at all. So I think really letting it go slow and easy and feeling the neural lock and help them to do the same thing in the homework, very, very, very important. And I think that the one thing that I have become more aware of in the later, perhaps the last year, is that I want the clients to do their homework slow, boring training.
Yeah.
Because the faster they go, the more stuff they engage. And the more diffuse and difficult the problem is, the less chance you are going to have of success, in my opinion and in my experience. So test light, learn to feel the neural lock. Don't get carried away to get the strength, because usually when you get strength, it's not true strength. It is a complex test. You get the complex rather than just reply from the muscle you want to test, right? And that's not really at least that is not what these tests are about. That is a specific test. You can do general hip flexion, for example. Many physios know these tests and so on, and a lot of practitioners know those general tests, right? But That's not really what NKT is about. It's more specific. It's finding, treating nervous system, treating those specific structures. And yeah, treating light, testing light, really going slow with the homework, palpating the structure as they're doing the homework, making sure they're not holding their breath as they're doing the homework, clenching their abs as they're doing the homework, going slow, all that stuff. For me, it has made a huge difference with the more difficult clients.
Yeah.
With clients that don't have so difficult issues, generally they will get better, right? If you're a little more sloppy, if you will. Yeah. So I think strictly NKT wise, that is my recommendation. If you want to include a little more things, my personal approach is to base my testing, like I said already, base my testing on posture, on their, you can see their breathing, for example, you can see the joint positions, stuff like that, right? Then it will be much easier to know where to go next, and you can trust your results better rather than finding a pattern. You test it out, it doesn't really work. You try again, maybe it gets a little better. When you start to when you combine structure and other findings, single leg stance and all this stuff with your testing, then you can trust what you're doing much more, in my opinion. And it builds more confidence, and it will, at least for me, it helped me to have much more joy from my work.
Yeah, absolutely. Yeah.
And NKTs are really fun. Sorry to interrupt you. No. NKT is a really, really fun thing to do. In study groups, I could stay for 6-8 hours because it's so much fun. NKT is really fun to work with.
Yeah, it's really true.
Fun. Yeah, it's a lovely protocol, and it's a lovely modality, and it really brings people together to a common point of view. So I really love NKT. I'm so happy I took it, and I'm so happy that David created neurokinetic therapy, right? And we see people all over the world are saying, this revolutionized my practice, and how true it's really true. Yeah,
it was absolutely. Yeah, it's fun for us, the therapists, but we got to keep it boring for the clients, like you just said. Yeah. No, yeah.
Yeah, but it gets funny when they get results.
No, absolutely. Yeah, it's fun for them too when they get better. Yeah. Well, KJ, it's been great advice, great stories. I've loved talking to you and hearing from you. So I know you got a course coming up that people can find on your website. You've got a lot of really great articles, and the website will be down below, so people definitely check that stuff out. Thanks so much for being here. It's been a pleasure, KJ.
Thanks so much, Brian. I really enjoyed the talk, and I wish you a great evening.
You too. Bye.